Hello, welcome to a new tutorial presented by the SchrDbb. In this tutorial, we're going to visualize birth asphyxia. We're going to see birth asphyxia, prematurity, and low birth weight. So we need to know that all these three are going to have the same management, the same investigation plan, and the similar management plans. Basically, so we're going to work all through together. Basically, and when working with these three tutorial, we're going to visualize the SchrDbb algorithm, which states that SchrDbb algorithm, which states that we are going to have at the middle you have the disease, then you have differential diagnosis and the endemic disease. Above you have the cause, then down you're going to have the complication, then outward you're going to have the background, and then down here you're going to have the prognosis. So those are the elements. So after visualizing that, this diagram is going to correspond to another diagram of the SchrDbb, which is going to be, you're going to have, this is going to correspond to the mechanism, and then up here you're going to have the pathogenesis, then now you're going to have the pathophysiology, then outward you're going to have the epidemiology and the risk factors, and then lastly you're going to have the follow-up. So those are the different things that you need to visualize in the SchrDbb algorithm. So we're going to use this SchrDbb algorithm in order to speak about the first one, which is birth asphyxia. We're going to first speak about birth asphyxia. Then we're going to still use it to speak about the second one, which is prematurity. Then we're going to use it to speak about low birth weight. So those are the three major elements that we're going to visualize. Basically, so when speaking about each of them, the first thing we're going to start by, we're going to speak about the disease. What's the definition of all of them? So we're going to start by speaking about the definition. After the definition, because inside the definition we already have partially the mechanisms, so we're going to speak about the definition. We're going to speak about the mechanism of the birth asphyxia, prematurity, and low birth weight. We're going to speak about the pathogenesis, from where does the birth asphyxia, prematurity, and low birth weight come from. After speaking about the pathogenesis, we're going to speak about the next one, which is the pathophysiology. Basically, after the pathophysiology of each of them, we're going to speak about pathophysiology is how the birth asphyxia, prematurity, and low birth weight results with its complication. What are all the physiologic changes in the body such that the birth asphyxia, the prematurity, and low birth weight results with its complication. After the pathophysiology, we're going to speak about the clinical presentation of a patient with birth asphyxia, which is pathogenesis, the clinical presentation of a patient with birth asphyxia, prematurity, or low birth weight, which is pathogenesis and pathophysiology. And then lastly, we are now going to go to the next part of our tutorial, which is going to be the investigations and also management and the follow-up. So that's generally how we're going to visualize the tutorial on the birth asphyxia and prematurity, basically. But now we need to know that the pathophysiology of them, all their pathophysiology are alike, basically. So the preclinical presentation of pathophysiology is going to be similar in all the different cases. So the clinical presentation that we're going to speak about is the clinical presentation of each of them. That's the clinical presentation of birth asphyxia, clinical presentation of prematurity, and clinical presentation of low birth weight. And the clinical presentation of the pathophysiology is going to be all alike for all. It's going to be similar for all of them. So we're going to speak it, so we're going to generalize it for everybody, and then we're going to speak about the investigation, the management, and the follow-up. So generally that's what you're going to speak about in the tutorials of birth asphyxia, prematurity, and low birth weight.